most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show all of you good folks out there how to fix Achilles tendonitis in 3 to 5 minutes. And this is real amenable to treatment. There's two options. Well, actually, we're going to talk about 3 options, right?
Right, a bonus.
Yeah, that's right. We always add a little more than you expect. If you are new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day.
There
Brad,
you go, Bob.
That's the
you
way
thought I was slow.
You're really timely, aren't you?
Yeah.
Also, you're going to want to join us on our social media channels, especially go to bobandbrad.com, giveaways, because we are giving away, Brad?
The mattress?
The SleepOvation Mattress. You're supposed to say it majestically.
Yeah. Well, I did my best job. I gave it a shot.
All right. Join us on Instagram, too. Official Bob and Brad. We just hit 10,000, Brad. That's a big number.
Wow, yeah.
It's a big number. All right. So what are we doing here, Brad?
Well, Bob, Achilles tendonitis, oftentimes affected by people who walk a lot, run a lot, maybe up and down hills. You haven't been out and you did a weekend thing and all of a sudden you got
weekend athlete or weekend movement.
But one way or another, however you've got it, you're going to feel that pain in the Achilles tendon. And, you know, if you've had it for more than a few days or even it's been chronic, then it's really time to get after it with this treatment.
Now, it's not just, we're not talking about the calf itself. We're talking about the tendon.
Right.
Tendocalcaneus, right?
Well, there you go.
That's the name, but it's a very thick tendon.
Oh, right. It is, you know, it supports all of your weight every time you take a step, or when you run, it really accepts a lot of force and stress.
Right. And if you tear it, it's one, though, that it can actually, like if you're an athlete,
right,
you're going to be out for a year. You know?
Yeah, it's a big one, but we're not talking about a tear. We're talking about
talking about minor tears.
Right.
Yeah.
Yep.
Quite
so
often.
The first thing to do is do the cross friction massage.
Yeah.
And we've went over this before, and we have a lot of comments, people coming back saying, boy, that really worked wonders on me.
Yeah, and there's a specific way to do it. Again, what we're trying to do is break up the scar tissue and get more blood flow to the area.
Right.
And this really works quite well in this type of instance.
Right. I used it on myself about 2 or 3 years ago. Worked well. I've had it work well on patients. And some runner friends that I have as well.
Sure.
So you look at the tendon, and it works well to take your thumb and your finger, or your thumb and 2 fingers for support. And you're not going to go on the back side of the tendon. You're going to go around it and kind of get behind the tendon. There's the hollow spot, I call it.
Kind of on each side of the tendon, Brad.
Yeah, if I could. I can't twist my leg. Can you zoom in on that, Liz? Okay. So
he's not talking about the back. He's talking about this side and this side.
Right.
That's where you want to apply the massage.
Right. And you're going to get in there, and you're going to go cross friction is going to go this way, not the length of massage.
Across the fibers. It's like you're pinching.
Right.
You're pinching the tendon and then rubbing back and forth.
And you're going to get in there aggressively. We'd like to do this for a number of minutes, but your fingers are going to get tired,
right?
Typically after 2 to 3 minutes, and then you got to take a break. And you're going to do that. You can do that at least 3 times a day.
Now, if you would happen to find that it just is too tender to even do that,
sure,
then you want to maybe ice for a while and back off, or even work it up a little bit higher up just to start off with, and work off the area, and then eventually work into the area.
Exactly. So once again, you're going to, like Bob says, if it's too tender, come up. Otherwise, you're going to work it 2 to 3 minutes or until your fingers get tired. And then the other thing you want to make sure you do is the muscle here, the gastroc and the soleus muscles here, all connect to that tendon. They're responsible for that movement of the foot. So you want to make sure these muscles are not tight. If there's any knots in them, you want to make sure if this is loose, it's going to take the stress off of that tendon. So you're going to want to get in and do some deep massage in here.
Yeah, it's really good to do actually before and after exercise.
Yep.
Really before, a lot of times, I actually use a foam roller. And,
we're going to get into that, Bob. That's our option, one of our options.
So
if you haven't done this before, you want to go throughout the whole muscle belly, and oftentimes you're going to find a ropey or a tender spot, a tight spot, and that's where you're going to focus the massage. And you may work on that for, a minute or two. Again, you're going to be limited by your fingers. They're going to get tired. They're going to get sore. You just need a break.
Sure.
And then you can come back to it.
So we got some alternatives here, Brad?
Right. Well, I do want to go, and instead of getting right into the high energy ones, I do want to talk. Well, and then also you can stretch, and I really like using inversion or the incline board to do a stretch. And don't get too aggressive on this. If your tendonitis is really sore, you may not want to stretch at all.
You may want to hold off for a while and eventually work your way into that.
Right. You're starting to feel less pain. It's starting to feel like it's getting back to normal. Then you're going to work this stretch. So I wasn't going to get into that too much, but I really do like the inclined board for stretching. If you got a roller, this can be the answer for taking care of some of your sore fingers from the massage, and just use your body weight on the roller.
It's good for massaging the calf, but it really doesn't get the tendon very well. It's not going to do the cross fiber that you need.
Right.
But I do this one every morning before I run.
Oh, you do?
Oh,
with
absolutely.
the roller.
With the roller.
Excellent.
Mine's actually the vibrating one because
that's the advanced one. Now this, you can go like this, and I'm working from the knee and I'm going back and forth down towards the ankle. And if I cross over like this, it gets much more aggressive. And I got my butt up in the air. That's getting all my body weight on this.
Yeah, I had an episode of, as you know, Brett, of calf injury this year, and I'm like, I've learned my lesson. I'm going to stretch and not overdo it either next time.
Keep things pliable. And here the final option is to get real aggressive so you don't have to wear your fingers out, is get yourself an electric massager. And here we have, what is this one, Bob?
This is the Renfo. This is actually, the reason I like this one, it's a less expensive one. This one's $40 versus, like, if we used to mention the Pure Wave.
Right.
Pure Wave's fine, works well. I'd say works even a little bit better than this one. But this one does really well for $40. That's over $100.
Right. Yep.
So, and this one's got different heads to it, and some of them are really. What you want to show that one actually is can get in there quite well.
Yeah. Well, I don't know. It's kind of a distance, but
we call it it's like the nipple. What else can you say? It looks like a nipple.
It's a nipple. What are you going to do? But if that really can get specific on this particular injury.
And there's different ones too. Like this one has 3 rounded surfaces, so they can actually get right in there too. But that can get right into the spot.
Right. So I'm going to get right into that spot where we're trying to get with our finger and our thumb, and we're going to work that back and forth. And here you can do that for a number of minutes. And
are you going to go this way too or not?
Yep. Oh yeah. Good. Thanks for mentioning that, Bob. I was getting carried away because it felt good going up and down. I don't have the problem right now. But this should, after about 30 seconds, if it feels like it's getting numb or it feels better, then you continue to work it. You can work up 3 to 5 minutes, and Syriac says up to 20 minutes. But I'm always afraid to go that long.
Well, I just don't think you can do it that long.
Well, I mean,
maybe
with the massager.
Yeah,
that's it. So you want to make sure you do both sides. Don't just do one. And then you could get up into the muscle as well and just use this. And Bob's using the other.
Yeah, there's a rounded one. I mean, and it actually, this is what's different about this one too. It actually gets like a shotgun mode or
pulsation.
Rapid fire. What would you call it?
Intermittent. You can. We could come up with some kind of fun name. Here's a triple-headed one that that may work good for a large muscle like the calf. Whatever you do, which one works good, and you can. Yeah,
when it comes to like the calf and the hamstring, or even the piriformis muscle in the buttock, those are really hard to massage with your hands.
Yeah,
I mean that's
big muscle group. And
that's where let this thing do the work for you. I'm glad they sent us a couple of them, because that way we can do the lazy man's way to recovery.
Yeah, and you can get in there in those larger muscles when you really need to get deep. That tight spot's not superficial; it's in deep. That's when the nipple works out good.
Yeah. It's a family show, Brad.
I know, Bob. I know. What are we going to do about it?
Thanks for watching.
Good luck with
your... Can we battle?
I don't have my... I'm not going to mention it. Take care.
Thanks.